Corridor care is endemic in Wales. In the first quarter of 2025, every accident and emergency department in Wales recorded seeing patients in unsafe, inappropriate spaces, with almost half of patients waiting for an inpatient bed. Corridor care is a growing issue in our hospitals, but what does it mean and why is it a problem? Corridor care refers to patients waiting for treatment, assessment or care in inappropriate areas that are not designed for this purpose, such as corridors, car parks, and waiting areas. Last year, there were 1,500 patients waiting to be discharged from hospitals. A lack of social care provision and poor patient flow is crowding our hospitals, meaning people in Wales can no longer be assured they will receive safe, appropriate, emergency care in their time of need. Corridor care is causing harm to patients. Doctors and nurses across Wales are calling for urgent action. If a person who needs urgent clinical care is not in an allocated bed space, something crucial might be missed. They may deteriorate without being noticed. There may not be space to carry out emergency care, and surgery may be delayed, resulting in poorer outcomes and even death. We want to put a stop to corridor care. Help us to ensure that every patient is treated with dignity and given the best chance to survive and recover. Sign our petition today, which calls for urgent action to put an end to corridor care.